Neck and shoulder pain is the second most common reason Malaysians seek physiotherapy, and one of the areas where people most consistently delay seeking care or make the wrong first decision about what kind of care to seek. The difficulty is that the range of possible causes in this region is large, the presentations overlap significantly, and the symptoms that suggest urgency are not always the ones that feel most severe. A structured self-assessment is far more useful than intuition or symptom searching for navigating this, because intuition alone is unreliable in a region with this many overlapping pain sources. Let me walk you through the urgency framework for neck and shoulder pain and what it means for your specific situation. Seek emergency medical assessment the same day if you have neck pain following significant trauma, a car accident, a fall from height, a direct impact to the head or neck, before any physiotherapy or any manipulation of the neck. Cervical fracture and instability must be excluded by X-ray before the neck is mobilized or loaded. Cervical fractures can present with only moderate pain levels that feel manageable, which is exactly what makes this category dangerous when people seek manual therapy before medical clearance. Seek urgent medical assessment within 48 hours if you notice progressive weakness developing in your arms or hands, if your grip strength is declining, if you are dropping things you would not normally drop, or if there are any changes in your gait or walking coordination alongside neck symptoms. These are potential signs of cervical myelopathy, compression of the spinal cord itself, which requires imaging and specialist review urgently. The spinal cord does not regenerate well from sustained compression, and the urgency of this presentation is often underappreciated by patients who assume all neck and arm symptoms are manageable with physiotherapy and time. Myelopathy symptoms often develop gradually and can be misattributed to fatigue or aging before the spinal cord cause is recognized. By the time myelopathy is diagnosed late, some of the neurological deficit is often irreversible, damage that was preventable with prompt intervention. Seek medical or physiotherapy assessment this week for new arm radiation from the neck, pain, numbness, or tingling from the neck into the shoulder, arm, forearm, or hand that has been present for more than 2 weeks. 2 to 3 physiotherapy sessions per week for 4 to 6 weeks is typically sufficient to achieve substantial resolution for early-stage cervical nerve root compression. Also book this week for a first episode of severe neck restriction, where you are unable to move the neck normally in multiple directions, and the restriction does not improve significantly within the first 24 to 48 hours. Acute cervical facet joint locking, waking with a neck that can barely rotate, responds well to early physiotherapy mobilisation, and typically resolves within 1 to 2 weeks. Without early treatment, the protective muscle guarding that accompanies acute neck restriction can persist and drive ongoing pain even after the initial joint irritation has fully settled. A physiotherapy appointment within 1 to 2 weeks is appropriate for persistent neck and shoulder aching present for more than 3 to 4 weeks without any of the above features, for shoulder pain limiting overhead activity that has not responded to 1 to 2 weeks of self-management, and for recurrent episodes of the same neck or shoulder problem returning repeatedly. A 2 to 3 week self-management window is reasonable for typical postural neck pain, mild to moderate upper trapezius tension, and general shoulder aching after an unusual physical effort. During that window, the most effective approaches are reducing the specific activity or posture driving symptoms, performing cervical range of motion exercises within the pain-free range, and using HIIT for muscle relaxation. Slow, gentle neck movements in all planes within the comfortable range prevent the progressive stiffening that extends recovery time in neck conditions managed completely passively. Avoiding sustained forward head posture during this window, monitoring screen position, phone use, and pillow height addresses the mechanical driver while the tissue settles. The neck and shoulder self-assessment tool in the link in the description helps you place your specific presentation in the right urgency category. It uses the same clinical screening that a physiotherapist applies at triage and gives you clear guidance on the most appropriate next step. The tool takes 3 minutes and removes the guesswork from what is often a genuinely confusing decision about what to do next.